We're glad you could join us for today's Streetcar Tour. We hope you enjoy your visit. Whether it's the local wining, dining, or entertainment, only the best will do. Much like the research done at Hamilton Health Sciences. We are pleased to profile two researchers to represent this year's New Investigator Fund and Early Career Awards recipients. Dr. Tara Packham at the Regional Rehabilitation Center and Dr. Melissa Parker at McMaster Children's Hospital.
So the idea I had was trying to develop a way of identifying people who have a pain syndrome that develops after trauma.
As the pain syndrome is difficult to diagnose, Dr. Packham is developing new testing procedures that will help with the accurate diagnosis and treatment of this condition.
I'm so excited about the opportunity as a researcher working with patients and helping them to see the maximum recovery possible.
Dr. Melissa Parker is studying the effects of IV fluid on pediatric patients experiencing septic shock.
So we will eventually arrive at an answer as to whether more fluid versus less fluid, which leads to the best outcomes for patient in terms of survival. It's a privilege to be in a position to be able to intervene and to make a difference in children's lives.
In collaboration with international colleagues, researchers at Juravinski Hospital and Cancer Center are exploring ways to engage patients in their own care with treatment that is tailored to their unique needs.
This project is about designing innovative models of care to better support patients receiving precision medicine. We want patients to not just survive, but to thrive following a cancer diagnosis. And precision medicine offers tremendous improvement in health outcomes and quality of life for our patients.
I'm hoping this project will accomplish better symptom management for patients, better patient-reported outcomes and satisfaction with their treatment. I went into medicine because I wanted to help patients. I love being able to do that every day, bringing them treatments that are sometimes the first on the planet, which is a really exciting part of my day.
An exciting pilot study at Hamilton General Hospital aims to improve outcomes for cardiac patients.
The most frequent complication after cardiac surgery, the one that patients fear the most, are neurological complications like stroke, confusion, delirium, and memory loss, short-term and long-term. The fundamental question we want to answer is what's causing that? When we find a way to protect them against these complications, they will benefit greatly from that. Potentially down the road, it will revolutionize completely the way we do cardiac surgery, the way we handle these patients who are more at risk of neurological complications. Sometimes you're dealing with patients who are having so much pain or so much in trouble, and you just bring them to the operating room, and the next day they're smiling at you and they're happy. That's very, very gratifying.
Researchers at St. Peter's Hospital are developing an online portal called iGeriCare that will facilitate the education of caregivers to people diagnosed with dementia.
Dementia is something that's very hard for people to understand. As a person's personality changes and erodes and their behavior changes, and they can't function independently anymore, it really has a major impact on the caregivers. I want to improve their quality of life and help them navigate the healthcare system better, understand what's happening to their loved one better. This is a real practical investment in people that are providing the care directly, who are passionate about delivering better healthcare to their patients, improving their quality of life.
A research project at McMaster Children's Hospital is aiming to develop and assess a standardized approach to the diagnosis and treatment of patients with abdominal pain.
There is a number of children every year who are thought to have had appendicitis, who are brought to the operating room, and in the end they don't have appendicitis. And so we're trying to see if we can reduce the number of admissions to hospital and unnecessary tests, and reduce the number of unnecessary appendectomies. What's exciting to me is taking care of people. I find that extremely rewarding.
Research matters for everyone. It transforms healthcare and changes the world for you and your loved ones. Your support of vital research at Hamilton Health Sciences makes a real difference in people's lives today and tomorrow. Thank you.